Imagine waking up to this alert on your watch. Your sleep could be slowly killing you. Hi, I'm Dr. Akshay Parmar, a practicing board-certified prosthodontist and a clinical faculty at NYU School of Dentistry. And today, I'll be talking about a silent killer that affects 1 billion people worldwide. That is approximately 1 in 7 adults. And interestingly, 80% of these people don't even know that they're suffering from sleep apnea. In the next 4 minutes, you'll learn if you are at risk, the shocking health consequences you're facing, and how your dentist, yes, your dentist, could save your life. Stay tuned. What you're going to learn in the next few minutes could be a matter of life and death. What is sleep apnea? Imagine you are trying to breathe through a straw and someone pinches it and shuts it. This is what is happening in sleep apnea. When you're trying to sleep, your muscles around the throat collapses, making it difficult for you to breathe. It is episodic, and depending on number of episodes of lack of breathing that you have during the night's sleep, it could be classified as mild, moderate, or severe. Now, this makes it very impossible to have a good night's sleep, and you might wake up restless and feeling lack of energy, even after you thought you had a good night's sleep. Number 1, loud snorers. If you are actually waking up not just your partner, your neighbors, then you are at a potential risk of sleep apnea. Overweight individuals. Carrying that extra weight around your neck can actually press onto your throat muscles and lead to difficulty in breathing in such patients. Men over 40. Unfortunately, because of the anatomy of the throat and the muscles around, men, especially when they age, are more at risk of sleep apnea compared to women. Family history. If you have a family history of someone having sleep apnea, then you are most likely to be susceptible to sleep apnea. Drinkers and smokers. We have all known that alcohol relaxes those muscles, making it easier for airway to close up. Now, smokers, what does smoking does to you is it inflames and irritates the muscles, making it harder to breathe through. Now, how do you know if you have sleep apnea? It's great that a watch can indicate that you might have an episode or you're at risk of sleep apnea. But for rest of us who do not have this watch, you might have to look out for the following signs. If your partner or your neighbors are telling you you're loudly snoring at night, that means it's time to take it seriously. If you're waking up in the middle of the night, gasping for air or feeling breathlessness or choking, that means you just had an episode of sleep apnea. Feeling restless or sleepiness throughout the morning even though you had a good night's sleep. That is because during the sleep apnea, your body did not get enough oxygen and hence you did not get good sleep, and that's why you feel tired and more sleepy during the rest of the day. And lastly, morning headaches or dry mouth. If you see one of these signs, then it's time to take this condition very seriously. Health risk. This is where it gets really concerning. Untreated sleep apnea can have serious ill effects on your overall health. Number 1, high blood pressure. Because your body is not getting enough oxygen, the heart has to pump even harder to make more blood being supplied to the rest of the body. Number 2, increased risk of heart attack and stroke. Because the oxygen is not reaching to your vital organs like your heart and your brain, there's an increased risk of stroke as well as heart attack. Number 3, depression and anxiety. Just because you did not have a good night's sleep with enough oxygen, there can be an imbalance of mood and cause mood disorders. Type 2 diabetes. Not getting enough oxygen in your body can make your body resistant to insulin, which can make you more susceptible to type 2 diabetes. Sudden death. Now, in severe cases of sleep apnea, there is a possibility where your body is fighting for oxygen when you're sleeping but does not get enough. And hence, that's why, tragically, a lot of people may not even wake up after this episode. You guys must be thinking, why a dentist is talking about a sleep apnea? Guys, when it comes to spotting signs, we are detectives. Especially because we look into your mouth, we look into your throat as well, and we could be the first people who could see those signs and symptoms of sleep apnea. if we see the signs, we do refer it out so that you can have certain tests like sleep studies, which is called as polysomnography, which can help you. Also, as a dentist, we make certain appliances that can help you open up the airway and have a good night's sleep. So let's wrap it up with a small analogy. Imagine your body is a car and the fuel line of the car is your airway. In sleep apnea, what is actually happening is someone's pinching onto that fuel line, and whenever you're trying to exit the car, it sputters and finally slows down because not enough fuel is reaching the engine. Same thing is happening with sleep apnea. When you wake up, you're feeling tired and restless because enough oxygen during your night's sleep hasn't reached your body. And hence, treatment of sleep apnea is like unpinching that fuel line. Suddenly, everything is running smoothly and you're waking more energized and more healthier. You might have clicked on the video because you're a tech savvy and you wanted to know about Apple Watch and sleep apnea. You might also like our video on electric toothbrushes versus manual toothbrushes and which one's the right one for you.